Kgalema Motlanthe Foundation Inclusive Growth Forum, Minister of Health Dr. Aaron Motsoaledi questioned why the National Health Insurance Scheme cannot be funded by the Public Investment Corporation. The PIC is an asset management firm wholly owned by a government with 2.7 trillion rands of assets under management.
We are told here that we must improve public health care first. Facilities, infrastructure and all that. I'm not denying that I want to. But I want an answer, especially from you here because you're opinion makers. Private hospitals get money from PIC, Public Investment Corporation, to build a private hospital and buy equipment for them in exchange for equity. I've been knocking at the doors of Treasury for the past 10 years asking for the same. Why can't I use PIC money to build public hospitals? Why should it be private hospital that is built from public money and I can't use that? Then they attack you and say there's dilapidation in Helen Joseph all over here. I want that money also. Then I'll look like a human being.
Meanwhile, National Treasury says the NHI fund, enabled by the NHI Act, will take 2 to 3 years at minimum to establish fully. Presenting to the Standing Committee on Finance and Select Committee on Finance, National Treasury says much of the financing towards the scheme is through indirect grants. South Africa has budgeted 2.5 billion rands, of which is indirect health spending, and 460 million rands, of which is direct NHI funding over the 2025 medium-term expenditure framework period. The direct grant relates to the National Department of Health's preparation for the implementation of the NHI. This includes the testing of reforms, improving services of primary healthcare facilities, and aligning infrastructure with national and provincial policy directives.
NHI Act is quite clear that a public entity must be created. It's also quite clear that there must be a consolidation and coordination of funds that currently sit in. So there's more to the NHI than just talking about adding money. Indeed, it's actually about coordinating the existing public sector health function more than anything else. And those processes will take time. With that as a background, we do have an indirect grant for the NHI that is in the baseline, and a direct NHI grant over the MTF to strengthen the public healthcare system in preparation for the NHI. There are also other elements to NHI, which is that it's not just about NHI as a concept, it's about the public sector health system, which includes revitalizing the health facilities themselves.
Dr. Motsoaledi was asked in Parliament by the DA whether he discussed the possibility of using PIC funding to build public hospitals with Cabinet, and if there is an agreement in place with the PIC to fund the building of the public hospitals. In writing, Motsoaledi said this is work in progress, making reference to the meeting that was held between the department and Treasury on the 30th of September, which resolved that a follow-up meeting would be held. Diabo Seto, SABC News, Johannesburg.